morning, everyone. My name is Dr. Marcus Penn. I am a community health and wellness physician and consultant. My organization is Self-Care Reform, and the website is selfcarereform.net on the performanceshows.com. But I bring information, health, wellness, empowerment, and healing from yoga and meditation practices, and work with various community-based organizations in Alameda County.
Good morning, and my name is Genetically. I am a fitness consultant and a lifestyle holistic health coach. I teach a fitness class and also do health education workshops in the community. Just real passionate about empowering our community to really kind of take an active responsibility and active role in their health through moving their bodies, reducing stress, and eating healthy. And my company is Fit for Life Health and Wellness Services and Fit to Serve Health and Wellness Services. Thank you.
Good morning, I'm Wright Lassiter. I'm the Chief Executive Officer for Alameda County Medical Center. My organization provides health care across the community. I oversee, as part of our health system, Highland Hospital, Fairmont Hospital, John George, Psychiatric Hospital, and several federal qualified health centers in Oakland, Hayward, Newark. Our organization exists to ensure that everyone in our community has access to high quality health care. And so I'm quite passionate about ensuring that access is not just access, but it's access to high quality, excellent health care that meets people where they are. And so I'm happy to be here and looking forward to participating in the panel.
Hi, good morning. My name is Donna Carey. I'm a pediatrician, and I have worked in various capacities in the Bay Area. Just recently, actually in November of last year, I decided to strike out on my own, and I have formed what I consider a very innovative, what will be a health complex. It's called the Blackstone Street Foundation. We will have an immediate care clinic, as well as services for adolescents, mental health services that support seniors and their meal so that they can stay in their homes for a longer period of time. And then also we will have a health and wellness center where we will have health education classes as well as wellness classes such as yoga and meditation to help with stress. So that's me.
Okay, I'm going to start with a question for the panel, but we would like this session, and we have about 1 hour. Our monitor will keep us on point, but please, if you have questions that you came to this meeting with, just ask. Even if it's not pertinent to what we're talking about, we want to have feedback and active discussion. What I would like to ask the panelists, from your perspective, what are the 1 or 2 most pressing issues for U.S. healthcare reform, our health system? CEO Lassiter, you want to start?
Be happy to. So, most pressing issues around the healthcare system. I would sort of start off by saying that when we talk about reform, and we look at access to healthcare in this country, go to point 6 of Bobby Seale's 10 points around Black Panthers, which says that we should have free access to health care for all oppressed Black people. And so start with the notion that everyone should have access to health care. So one of the most pressing problems from my perspective is that as a society, we don't believe that. If we did, it wouldn't be so difficult for a president to pass health care reform. It wouldn't be we wouldn't be having debates as I was having 48 hours ago with one of the board members of Covered California, the healthcare exchange, what their view of co-pays and deductibles should be for people at 200% of poverty and below, and that individual's belief that everyone should pay something, even if they can't afford to pay something for health care. So I think one of the most pressing problems, first and foremost, is that our society has to decide that health care is not a privilege, but is a right of everyone who lives in this country. Yeah. Then secondly, you have a whole host of issues around how do you go about doing that. Healthcare reform, the legislation is really mostly about coverage expansion and a little bit about insurance reform. And that's an incredible start, and I applaud our president all the time for taking this on. But that doesn't fully reform our healthcare system. It doesn't address issues of supply, of physicians and nurse practitioners and social workers and folks who need to deliver care. It doesn't fundamentally change the fact that the incentives for healthcare in this country are still based upon doing something to people generally when they're sick. And if you talk about how you reform the healthcare system, it really should be about keeping people from being sick. And so, as some of my colleagues are talking about issues about healthy lifestyle and health promotion, health prevention, the reform legislation does not fully incentivize our healthcare system to focus more on that. And so as the CEO of a hospital system, a healthcare system, I'm still rewarded for having butts in beds. Excuse expressions, but at midnight, if your butt's in a bed in one of our facilities, I get paid. If your butt's not in the bed, I don't get paid. And so you have conflicting and constraining scenario. Pardon me, I've got a cold, so pardon me. Where I clearly have talked to my organization during my 7.5, almost 8 years there about managing a population's health. But the reality is our bills get paid when we click a meter because someone's butt's in a bed still. And so, those are two really big issues, changing the societal impressions around healthcare entitlement, and then talking about really reforming the system so that there are more incentives, so that frankly everyone functions the way Kaiser tries to function, right? And I'm not espousing Kaiser one way or the other, but they function in the sense that our goal is to manage your health. Our goal is to make sure you get a timely appointment to your doctor and to try to have incentives so that we have enough resources to put enough of that access available to you in communities where their members live, and keep you from having to go to the hospital. And so doing lots of things as opposed to that. And our healthcare system still is not incentivized to invest in health promotion, health wellness, education. We're still incentivized, frankly, to take care of sick people. And so we have a sick care system, not a healthcare system. And so those are two big issues. I'll stop there. So I'll step back now.
I just want to piggyback on what he's saying. One, about the access issue. We know that in Alameda County we're already a primary care shortage area in terms of physicians. So access for residents in our county is even more difficult than in other parts of the country. It also says that even though there are primary care physicians, that over half of us, over 50% of us, can't access our physician if we have an immediate need. So if we have a need for a same day or even a next day appointment, over half of us can't actually get into our primary care office. Anyone can attest to that? And so I think that that's definitely an issue, is not only having access to our physicians, but also having physicians who are competent culturally to take care of our patients. So for me, as part of healthcare reform, we also need to reform our medical education system so that we have a stronger pipeline, so that there are more physicians like myself and like Dr. Penn down there who you can come and see, because even though, of course, being black doesn't mean that we are culturally competent to treat black people, but we are much more likely to be culturally competent to treat our community than someone who's not black. One of the other issues for me is, as Mr. Laster was saying about preventable diseases, there's still a huge disparity between simple things like high blood pressure, cholesterol, diabetes, obesity. African Americans have a higher prevalence of every single one of the chronic diseases, you name it. African Americans have a higher prevalence of it. So healthcare reform really putting more emphasis on prevention, health education. The CDC put out a report that said, which we all can probably already know, is that as incomes decrease, the rate of people being hospitalized increases. And if we can decrease some of the health disparities we have, that we can save almost $67 billion in healthcare costs per year. $67 billion saved if we put more money into preventing disease and decreasing the gaps in some of our health disparities. And then lastly, as a pediatrician, I cannot say enough about infant mortality. I think that we really need to put more money into making sure that our little black babies that are born healthy, that they're born on time, and that they have the support system in the family in order to thrive.
Dr. Penn, and then we'll take your question.
Sure. Given that organization is called Self-Care Reform, I want to bring in how within healthcare reform, it behooves us to better take care of ourselves as best we can. And that's what I like to call self-care. So one of the kind of statements I like to say is that healthcare reform may have taken 60 votes in the Senate, but it can take 60 seconds in our lives. So we can just make a shift in our thinking and our consciousness right here and right now. But I think it's important to recognize with the changes in healthcare reform that there are some preventive services that are available, that are more available, and that are free. A lot of cancer screenings, I believe mammography screening, colon cancer screenings. There's also mental health screenings that can be done. I believe more of the, speaking of infant health, immunizations I think are covered as well. So I think it's important to be informed. That's one of the tenets of self-care reform for me is information. Second is empowerment, and then healing. The empowerment comes after getting the information, as much information as we can, and everyone being here, that's all about getting the information. The empowerment comes once we recognize that, that something needs to be done. We know that our statistics are at either the highest or the lowest, and neither of those are things, unfortunately, to be proud of. But that change is what can happen. And then lastly, the healing comes from knowing where more points of care are. So where our community clinics are, where our community services, where our ancillary services, where our supportive services are, whether, again, mental health, support, recovery services, however. So I think I'm hoping and planning and visioning that our conference here will allow those nets to get tighter, and that we can have more collaborations and again, develop our own self and healthcare reform to happen at the same time and build our communities.
African American children, by the time they're 11, almost 70% have never been to a dentist. They've never had a teeth cleaning. The other problem is Medi-Cal pays $34 for a cleaning. It doesn't even make sense. So 98% of the dentists, black and white, in Alameda County will not see Medi-Cal dental patients. And so how do we resolve that issue? Because what we've got is a snowball rolling down the hill, and we're creating long-term health care issues for our population.
So Carl, I would mention a couple things, and your statistics are quite right. So one of the things that we're doing at Alameda Health System today, actually, we have an event going on right now called Give Kids a Smile in East Oakland, where we're actually opening up our dental facility and are trying to bring kids with their parents in to teach them about healthy brushing techniques, to do screenings, etc. And so our organization, even when our state decided to effectively almost withdraw from providing any sort of dental reimbursement, we continue to provide services for low-income kids. But we're only one organization. We can't serve it all. I think what we have to continue to do is show leadership around this issue and find ways to continue providing services even when funding isn't there. I've had a number of dentists come to me and say, I can't afford to keep providing services to those kids. I want to, but also a family to feed, and so I can't continue to provide that service. And so one of the things that we're thinking about is how do we more formally partner with community-based both physicians and dentists who have served states and their populations and struggle as independent practitioners, independent practices, because they cannot continue doing that and still feed their families. And so so I see it as kind of a personal responsibility for me as the state of the states and health system to figure out ways to do that. I don't have all the solutions at this point, and I think that where it starts with dialogues like this, and for us to continue talking through, so how do we garner resources, how do we create a stronger web, so that the folks who are committed to doing it don't have to stop doing it for purely economic reasons.
How do we get the people in these rooms to really get behind this? Because, you know, Affordable Care talks about your medical issues, but this is a real problem that seems to have escaped Obamacare. And this is a safety net for our children. You know, so I'm the chair of 100 Black Men, so we've started a dental screening program, and we've done other things, but we can't do it alone. You know, we need other people to help us.
I wanted to give opportunity for others. I know that you have had your hand up as well as who's next after you? Gentleman in the back, okay, so.
So I'm looking at the Institute of Medicine on behavioral health, done by Satcher. He has a definition of prevention, and it says it means different things in terms of health promotion to different people. That's one. So what is the different things to different people? How do you address the clinical inertia? Well, it's really racism in medicine that doesn't allow people to be treated in a humanistic manner. 2. 3, I'm a physician's assistant, been practicing for I graduated from Stanford in 1982. And I respect the panel, but I've worked some places that you guys wouldn't touch. And that's the real key. I don't see them there working at the places that I would do. Public health discussion. But I mean, frontline clinics where rubber meets the road, where the person's coming back from the prison, where the homeless mother just don't want to see them. And then trying to get reimbursement of the issue. So it's not Obamacare, it's Affordable Health Care passed by Congress and signed by the president. All right, so that's a racist tendency we have about hating ourselves too. So that being said, last question, healthcare system. We have patient-centered medical home, you know, those kind of things. Where is this going to play in those kind of arenas? And the reason why, and my final point is I run a cable access program. I've been taping for the last 15 years, had numerous people on healthcare issues. It's hard for me to get Black people to come out and get on these shows. Right, Lassiter came on when he first became a director. But essentially, we don't want to be in front of media because we're frightened of it, we're frightened of being honest, we're frightened of talking, so therefore we have a lone voice, and it's always, well, who gonna do it? He gonna do it, she gonna do it? That's another issue, I'm done. Oh, so this is my girlfriend, this is Barbara Harvard. She does a show called on Moral Public Radio National, so we're doing two things. TV on one end and radio on another. She does a weekly program. Would love to have any of you to come on and talk care issues, a whole hour program. So we ain't got no issues with that. So it's about what you want to do as opposed to talking about what you want to do. The venues are there, it's just what you guys want to do.
Yes.
And I'll take my answer.
Okay, so we're going to let you guys respond, and then we have you, and then you, and then you. Sorry. Okay. You guys? Okay.
Okay, so I just want to say, you know, when I was in medical school, I actually started a homeless and HIV clinic, front line, right there, rubber met the road. So don't mistake my appearance for saying that we don't dig into the trenches, okay?
No, you said none of you.
So
Most of us are meeting the rubber with the road.
Okay.
Exactly right. Okay. So we get into the trenches. So, but in terms of the preventive, and I think, you know, we all sort of spoke to that a little bit about the preventive aspect of the community.
I should define it.
You wanted to define preventive health?
Yeah.
So
It means different things to different people, even between specialties, prevention is a different issue.
Okay, so for me, preventive medicine is so that I can teach you to have the best health so that you don't need to see me except for once a year on your annual physical. That would be preventive medicine. So, and you know, everyone has their own different definitions, but I think that the key is, again, that as providers, the fact that there's, again, a lack of culturally competent providers that we have here in Alameda County. And to Dr. Garrick's point, of the pipeline of medical education, that even when we are educated and we come to Alameda County, it's difficult to be retained. It's difficult to get hired by some of the more established organizations, and I'm not going to call any out this fine morning, but I could. So it's an issue with retention of those who are here and want to work here, but can't often find work.
Ma'am, you've been waiting patiently.
Oh, thank you very much. And part of my concern is the cultural competence, not just of non-African American physicians, but African American physicians. Because I think that there are some issues in terms of genetics and healthcare that we don't really look at carefully. There's alternative medicine, there's alternative diets, and oftentimes, you know, you go to a physician and they'll say, you know, here, you know, don't eat soy. Genetically, African Americans are very allergic to soy. They're allergic to wheat. And a lot of the physicians, whether they're African American or otherwise, don't really know and understand this. My training is as a professional medical librarian. I retired from UC San Francisco. And I did a lot of research on genetic issues in healthcare and also alternative medicine. And I think that needs to be a real important component of cultural competence in medicine. You know, the coloring that you put in your hair, the straightening that you put in your hair goes into your brain. And when we get brain tumors and other kind of tumors, we don't understand that it's because we straightened our hair with some other stuff or put some coloring in it with some other stuff. So we have to really know and understand all of the issues that pertain to good health and preventive health.
Just add this really quickly to your comments. So we are behind much of the rest of the world around personalized medicine.
Yes.
And some of that is sort of related to the FDA and sort of regulation we've had at the federal level, which sort of defines what can and can't happen in this country in terms of how medicine's practiced. If you look at how medicine's practiced in Japan and in some European countries, there is always, physicians always have ready access to genetic information that tells them, that helps guide them around, because of your genetic makeup, you will or won't react to this kind of treatment. And frankly, and this is in populations that are much more homogenous than the U.S. population, right? Because we're such a melting pot that if any place, medicine should be guided by personalization is here. And so I think we'll find, from my perspective, in the next decade or so, that will change drastically. The issue that people keep bringing up around cultural competence, and a lot of that relates to how physicians are trained, is a significant issue. The graduate medical education in this country is a institution that has been structured the way it's structured for a long time. And one of the best examples of the medical community getting outside that box is to go and look at how our physicians are trained in Cuba. I spent a week in Cuba looking at the ELAM, the Latin American Medical School, where they're training students from all over the country, including some U.S. Kimmy knows, because she was part of that same group. And it's fascinating how they take folks from all over the world and really focus them on cultural competence. And they expect that those physicians will go back to their communities. And as George was talking about issues around patient-centered medical homes and all those kinds of things, that is a natural part of the training process there. And there are less than a handful of medical schools that have taken that on in this country, and have completely changed how they train physicians. And so that's an issue that will take a generation or more to address in this country.
Unless we get some Cubans here.
There are some
few places, if not the only place, where you go to a physician and they give you a prescription for herbal medicine or traditional medicine. You could get one or the other. Nobody does that here.
Yeah, I would just like to ask the panelists, how many of you, or any of you, have heard about what you're doing at the Native American Health Center in Fruitvale? For a minute, I'm a client. I've been getting my health services there for 8 years. You don't have to be Native American to go there, but I'm African American and Native American. I sought them out because I sensed that, since I don't like to take pharmaceutical medication, that maybe that might be the place where I could get some non-traditional medical care. And what I'd like to share is, on Thursday, they have a standing group that's open to everybody from 12 to 1. And people who have either high blood pressure, high cholesterol, high blood sugar, diabetes, or all of those, can come to a free discussion. And 1 week it's an exercise class, 1 week it's a cooking demonstration, 1 week it might be a film, but every week it's hammered into your head how to stay healthy in a proactive way. And if you go to Native American Health Center, if you're a client, you get a $5 grocery card as an incentive, and there's raffles too. And what I need to say is that I think really this is a wonderful model for how to deliver care, particularly to people of color, because Native American Health Center is very aggressive about getting culturally competent, relevant treatment for its clients. You know, I've attended meetings where sage was burned, where they brought in a Native American healer, and I've gone to powwows. So I just wonder how many of y'all have visited and maybe can go look at that model and see if it can be brought to other health centers with African American clients.
I do probably, but that, I don't know if you've had the introductions, but that's exactly the type of community health center that I am building currently. It's going to be in East Oakland. But that's exactly, okay, take your name and number afterwards.
I know how to make healthy food and
okay, great.
Yes, I wanted to, my name is Dr. Nobles. I'm one of the co-founders of the Black Association of Black Psychologists. So I want to slant the conversation just a little bit to point out that in these conversations, we end up talking about access a lot. We put mental health as sort of the footnote to health. And the fact of the matter is that mental health is an equal partner to health, and that in almost every case, mental health is the cause or the consequence of the health problems that we're addressing. But we don't have that conversation here. We never bring it up to this level of talking about what it is. Our community is assaulted, has been historically assaulted, resulting in some very serious mental issues that we never address, and then we wonder why they don't come back or they don't follow the regimen of health, etc. So I want to suggest to you that we look at that, and particularly in terms of psychology, I want to caution us that we have struggled for almost 30 years to point out that the diagnoses made for black people in this country have been inaccurate, and that we're seeing a rush of an overwhelmingly diagnosis of bipolar schizophrenia that we've never seen before. That's misdiagnosis, and misdiagnosis is equal to malpractice, but we don't talk about it that way. So I want to ask the panel to please speak to those issues for a moment, then you can put mental health back in the footnote.
Thank you.
And Dr. Pan is probably perfect to address that, but mental health is integrated under our new Affordable Care Act, and we're getting, the county, CEO Lassiter can probably comment more, is getting hundreds of thousands of dollars just to address mental health. As an emergency physician,
and
I
before
know.
he speaks to that, addressing it is not giving it the same old medicine.
Right.
You see, that's the problem, that the mental health diagnosis, the nosology, has not been interrogated from our cultural grounding. So while we get bunches of dollars, we end up giving our people the same old stuff. That's the critical. I want to point out that it's not just opening up mental health practice, now we can get it.
Right.
What are you getting?
Right.
What are we getting when we get that? So that's the issue that we, especially as black folk, have to talk about. And I say it again, misdiagnosis is equal to malpractice.
So I'm going to put it just a little back to the community and the audience. As the CEO Lassiter said, I'm personally a physician by training, and in the emergency department, I think 60% of the people, just a random number I'm guessing, I see is related to stress and depression. You know, they have a peptic ulcer problem, heart attack, stroke. It's the stress that they're under from losing their job, from not handling life stressors, from living just in East Oakland, that puts them at risk towards their medical problems. So I can address the consequence. But are you talking about the depression that your boys have, about the PTSD, about their mental health? Because I can't do it all. We need you in the community to address and make it okay to talk about the mental health issues. And now I'll turn it over to Dr.
So just statistics always wake us up. And statistics as it relates to mental health and physical health. Those who suffer from chronic mental health, unfortunate diagnoses, tend to die 25 years earlier from preventable diseases, diabetes, high blood pressure, heart disease. So with that, there are some programs that are looking to address much more of the mental health component of overall health. And one program that I've been working with is called the 10 by 10 Wellness Campaign, Alameda County 10 by 10 Wellness Campaign. It addresses 8 dimensions of health to bring mental health in the full picture of addressing one's life. And it looks to coordinate behavioral health services with physical health services, making sure that there's supportive services around as well. But what's being done also, I've been working with Recovery Service Center called Peers, People Envisioning and Engaging in Recovery Services. And they have been looking to address stress reduction, mindfulness-based practice, and I've been working with them and collaborating with them on that. So they're looking to bring much more self-awareness practices, changing of consciousness, and particularly with some of my offerings with self-care and self-care reform, I like to change the concept, and particularly as you would address, Dr. Nobles, about prescriptions. I'm always about empowerment, and I want folks to shift that prescription concept to a personal prescription where what's a behavioral prescription that I can address for myself? Yeah. What could be my thinking, what can shift? And so I have folks in the workshops share their prescription of change in their life. It could be something mental, physical, and emotional. So I just share these, these examples to let you know that we are looking to address much more mental health issues. This campaign has been going on. It's going to go on for 10 years. It's to actually help. This 10 by 10 Wellness Campaign is to increase life expectancy in those who have mental health challenges in 10 years by 10 years. And just some of the organizations that we work with are largely present.
Alameda County also has a program that they're doing now. I don't know if all of you are aware of its Early Connection. It was a pilot program that's brought here to Alameda County to actually look at how services are really administered to people with mental health. I've been a part of that since they got started, and we're coming around to our 3rd year. And I'm hoping by the end of this project that they will take, I've been doing interviews with families that have mental health issues, and how are we serving those families? And as a result of that, we're hoping when all of the data comes back, after all these interviews we've been doing, it will then begin to shape Alameda County more towards a family-focused support around mental health versus the approach that we've been using right now that addresses this gentleman's concern about, yes, mental health does go hand in hand with our physical health, but we have never really taken a step out of the box on how to serve them. The program we're doing now is something that hasn't been done. It's been done in Connecticut and a couple of other places, but not here in Alameda County. And I am praying that once this process goes through, that then we will begin to actually influence Alameda County on how we deliver mental health services, because that is the root of what's happening with the majority of our young people right now, because I do work in both areas. I know if we don't catch them when they're babies, give them services that they need for reading and writing and comprehension, that if we don't get them before they hit now 6th grade, we see those same children out on the streets right now creating mayhem in our community, and no one is out there helping them because we don't understand how to start.
CEO Lassiter wants to come in. We have about 9 more questions in less than 20 minutes. So if you can keep your comments brief, so we can keep the active discussion going. CEO Lassiter.
I would just respond to Noble. Your point is well taken, and I'm aware of what Dr. Penn is referencing, because we're also working the Peers program. And I would tell you that as an organization that gets the back end of people with mental health, and I say the back end meaning that I manage a psychiatric hospital and emergency department, and every year the number of visits to the psychiatric emergency department increase more than almost any other service we provide. Wow. And historically, we have just continued to say, how do we do that better, and have not really focused on the front end. And so we have, in the last less than a year, we have changed our focus to say that every one of our wellness centers needs to have medical and mental health. And so how do we build mental health into that so that we're talking about holistically? Are we there yet? Absolutely not. And so we're just on the very, very early end. But I think that there clearly is a recognition that we've got to integrate medical and mental health into a single care environment. The other broader issue you raised, or maybe more specific issue you raised around how patients are diagnosed and treated is an issue that I would tell you that at least within our health system we have not started working on, and that is a very significant issue, and we need to continue to work on how do we change what is a rut that we're in around.
The Association of Black Psychologists is very happy to work with you on that issue. Because that's our family business. I don't know who we're dialoguing with, consulting with, but that's an issue that we as black folk can come around the table to work with.
Sir, you've been waiting?
Yes, thank you. Joe Anderson from Black Men Speak. I'm also familiar with peers. I've seen you in the office. My question really is in regard to all of the professionals in the room. You know, we have a lot of African-American providers, professionals that do and recognize all of these needs. But my question is that if we all know this, we can all possibly get together, because we recognize Alameda County is not going to pay you for what you're worth. They're not going to keep you because they already get funded, and to keep someone else there who is probably on a nepotistic basis. You know, maybe not pronouncing it right. But my question is, why can't we create an organization sort of like East Oakland Recovery was, that where we have black psychologists, we have black people who rotate professionally, come and set up services for our people, because we recognize that they're not going to get these services anywhere else. They're going to be misdiagnosed, like Dr. Wade says. We like to get with you too at Black Men Speak. There's a lot of things that we can do. The reason I'm here is I am a black man and I'm speaking for us in the black community. We can talk about this stuff all the time. I'm at peers all the time. I'm on every board, every social inclusion, housing advocacy board. I'm on the board with the Berkeley Drop-In. We talk, we talk, we talk. We recognize the problems, but all we do is talk. You know, there's money out there. We say there's no money. There's a lot of people that I don't have that kind of money, but if I did, I'd be willing to put money into it to help others and all of us build on this. The biggest thing is that we got the money. We don't need Alameda County's money, because once we start doing something for ourselves, there's so many grant writers in this room, it ain't even funny how many people wrote a grant to start an actual business. See, you know, you got the whole professional scope right here. You know, we're all sitting here complaining about what? Actually, we're not complaining, we're just not doing it.
Well, brother, I think to address your concern, if I may, you know, raise Dr. Carey. I mean, she has just shared with everyone in the room that she is constructing a clinic and health center that is going to particularly integrate, you know, the health in so many of the areas that you're speaking. So it's happening.
That's my concern.
It's happening.
With you. I'm sorry. Maybe I was a little late getting in here. Dr. Carey, I want to share with you.
Okay, gentlemen in the coat.
Thank you. I was also a little bit late here, and I didn't even get my registration, but I noticed the name of this program is Making Connections. My first question is, with all the distinguished people that I see in this room, how is this set up to make connections? Are they in the syllabus? Are we doing, is there a mailing list? That's number one.
Okay.
Number two, a pet peeve of mine is that I hear from the psychology, I am not a psychologist, but it's one of my areas, real strong areas of interest. Education is also, and brain development is also a very strong area. There have been techniques and technologies that exist in this world that we seem to be, we meaning the people of color, seem to be the very last to get access to seem to be the very last to get. There's a new measurement for blood pressure that is central systolic blood pressure that the National Medical Association is recommending for every Afro-American with high blood pressure. And all the doctors that I've talked to, all the medical people that I've talked to, nobody seems to know about it. Now I understand that people are really busy in their own in their own world, and the system keeps us busy so we don't look out. But I really have, I look for some type of mechanism that brings, outside this country, we are acknowledged as pioneers in the world. Inside this country, they look down on us. There are a lot of allies that would look to work with us and bring that information in. We don't have any mechanism. So those are.
I'm going to comment on the first question, and we're going to be running out of time, and we will get in trouble if we don't cover this piece. This is making connections, and so the conference organizers have prepared 3 different ways for that to occur. The first is that in your packet are a list of classes that are offered. Are they here? They are. Yeah. A list of classes that are being offered that are related to the different topics that are being discussed here. If you're interested, please, follow the instructions, sign up for the classes. They also told us to tell you that if there is a topic that is not here, that those of you who are here are interested in, if there are enough of you, that the conference organizers will help to organize a class being added, or a seminar or workshop being added around something that's not being offered. Second way is that the conference organizers have established a website or a social networking site, and it's called Black Link, and it's a Ning site, and Ning, N-I-N-G, and it's actually in your packet, and it looks like this, called Black Link. Okay. And what we would like for everybody to do is to go register, get on like Facebook, like LinkedIn, and become a member of this site so that we can all stay connected to each other and take the next steps. Last is that even though this is health and wellness, there's a third opportunity through one of the conference organizers. If people are interested in entrepreneurial ventures, that sort of thing, Ali, I forget Ali's last name, I have cards. Okay, Ali R. Rashid is going to be providing some pro bono technical assistance for individuals who are creating new businesses and want some assistance in that area. So that's just that. We have some questions.
We have 3 more that I'm going to take, and they're from the 3 gentlemen in the back. This gentleman in the gray suit has been waiting. Okay.
Thank you for clarifying that for me. It did say something about strategies and offenses by community. If this was happening in any other country, we would declare a state of war. What's being done to us? Brother Noble, all of the people in the room today, it has to be another opportunity for us to come together. So I hope, I'm just trying to package this thing right, because this has to be done once a month. You can't do this once a year type of thing. You're talking about community-based participatory research that can manage this whole thing for us and bring these people to the table. Money is not the option. But this is an economic problem, a social problem, a political problem, a medical problem. It's all kind of problems tied into one. We have too many churches in this community that we can't sit down at the table and utilize what I grew up under. What you're talking about right now, I did when I was going to high school. In grade school, I learned everything about the human body, self-management of the body. Come on, we came out to 7th grade, we knew all that stuff then, but what happened, something happened in our communities that Brother Noble will probably break down a little bit better. So I don't want to get into all that type of thing, but how can we continue this type of thing? And consistently work with people who do community-based participatory research. These colleges have done everything for us already. All we have to do is organize and come together. We have a mental problem. That's what the problem is going on with us right now. That's what's going on.
2 more questions, and then we'll give the panelists the final. There was a young man that
he's right here.
Oh, okay.
Thank you. Make sure everybody signs up for blacklinking.com so you can also continue this conversation. You can chat, you can share best practices, you can do that. Make sure you go on and do that. Use the app. Make sure you do that. Everybody should sign up for that.
Can we go past the time, Keith? Go another 10 minutes?
You can go over time. Sure.
Jocelyn, we can go over the time. The leader said
about 10 minutes.
great, because there's some issues we need to really address.
Thank you, everyone. My name is Craig Wingate. I'm from the Alzheimer's Association. Part of my job is to go out into the community to educate individuals about Alzheimer's disease, also known as Alzheimer's and dementia. My question for the panel is, one of my hats is to do presentations, and the other one is to partner with physicians around educating individuals about Alzheimer's disease, because we are 2 times more likely to develop this disease, and there are currently 4.5 million people living with this disease, and it's expected to triple. How do I partner with physicians that are really, really busy, letting them know that we're there to help and assist them? And my second question is, do you see a shift in priorities in terms of senior health? Because more and more seniors are, or more and more people are getting to that senior sort of line in terms of their age. Thank you.
Real quick, brother, I want to share with you some African American medical associations based in the East Bay. One is called Sinclair Miller Medical Association. You can write or however we can connect. Another one based in San Francisco. The physician who's the president of Sinclair Miller is Dr. Katrina Peters, Katrina. And the San Francisco organization is called John Hale Medical Association, and that is run by brother Dr. Justin Morgan. So those are 2 that you can have as great outlets for you.
Okay, thank you.
Thank you. Volunteering shouldn't silence you. So I work for behavioral health care in the county, and we right now have $2 million to focus on isolated adults and older adults in mental health. So making the connection for me means telling individuals about resources that are available. It was quoted earlier by Dr. Penn that 25 individuals die 25 years younger. That's for the general population when they have SMI. When you're an African American, it's more like 35 to 40 years younger. This conference is for African Americans. I need to make that clear, that when you have a mental health challenge, and it's untreated, which is what we see in our community when we have African American males pulling out a gun, shooting and killing themselves. That's unaddressed mental health. That's the only thing. It's suicide by proxy. And we don't talk enough about the fact that when we have something like what happened in Newtown, when one single person pulls out a gun and kills 20, mainly non-African American kids, it makes the press. We start talking about gun control and all of that. But right here in Oakland, we all know someone probably was killed violently, and we're not putting our money in our discussions around that happening, and we're blaming victims. And we gotta stop blaming the victims and start going after resources and putting the pressure on the police department, whomever, and I guess there's gonna be another panel about that, but that's unaddressed mental health. That bursts in an individual in school settings, etc., when they're told they're not good enough and no one seems to care about them. Well, if I don't care about me, then I certainly don't care about you, and you look like me. Suicide by proxy. And you could, right, and you should be signing up to be on the review committee for the behavioral health care dollars, because another thing that happens is we did give money to the Native American Health Center for them to do things in a culturally responsive manner. We did give money for the API community for them to do acupuncture and tea and what's the name of it? Any form that they have. We did give money to every other community, but when it comes to African Americans, because we speak English, they believe that we don't have our own ways of doing things. It does start a lot in the church, but we got to train our churches too, because taking someone to the back room and laying hands on them does not work. So I just had to get that out, and I'm sorry.
Yes, Brandon Reams. I just wanted to address it, especially the physicians and those on the panel. I'm interested, and I want to hear more about what are, in your hospital situations, are you dealing with healthy solutions, supplemental items that we can take that will help us prevent diabetes, but healthy, OPC3, calcium, fish oils. I've been going to classes for over a year outside of our community, getting supplemental things that will prevent these things. And now I'm working with our ministry. In January, 75 of us did detox, which deals with the digestive. But so I want to hear, because other physicians now are bringing supplements into their offices. What are we doing with supplemental, things just on that nature?
Yeah, so I've always been a big advocate for supplements. I do pediatrics, so in all of my children I do an iron, I do a vitamin. We talk about vitamin D and calcium with all the seniors that I deal with at my church. So I've always been a big advocate of supplements and making sure that when people talk about how to have your best health, that it doesn't always come in a bottle of pills, but that it comes in the form of things that we eat and how we eat and when we eat and what we do in other aspects. But also just to recognize that a lot of physicians, the reason that we're getting a lot of supplements in our community is because there's a huge incentive, okay? So it's not a lot of it is because they necessarily believe in what they are telling you. And so you want to make sure that when you go to a provider, that the provider is telling you about the supplements and that they believe and are actually using those supplements, and making sure that it is based and rooted in the science of the exact amount that you're taking, that you take supplements that are approved by the FDA. And because a lot of supplements and herbs are not regulated, so they're not safe. So we just need to make sure that we're educated about what we use and why we use them. Yeah. Carl?
I've got two quick things, and I know the time is an issue. One is hepatitis C. Hepatitis C is rampant in Alameda County. There's a real problem, which I need everyone's help in. The state of California does not allow condoms in the prison. Alameda County Jail does not allow condoms in the prison. They allow it in San Diego, they allow it in San Francisco, they allow it in LA. And these men who go into prison are not homosexual, but they have sex. They come back out, the infection rate among African American women is 3 to 4 times that of Caucasian women. So we've developed a program on the board of Center for us where Genentech, Gilead, and Merck are going to give us $9.5 million worth of drugs for the therapy. And we're working with Alex Briscoe now to develop an outreach program. And so I need you to write your senators, I need you to write your state legislators, because the state of California did a study in the prisons that basically said the use of condoms reduced the spread of HIV and hepatitis C by 65%. But they won't release the study because they're saying, if we give you condoms, we're condoning homosexual sex in the prison. The other quick issue is the ambulance and paramedic service in Alameda County. I don't know that most of you know that if the paramedic by contract has to show up within 9 minutes, but the police show up in 30 minutes. The paramedic cannot treat you if you've been shot or stabbed until the police show up. So you lay there for 20 minutes untreated. I mean, by law, they cannot treat you until the police come and clear the area. And so if you've been shot and you're bleeding, the paramedics have to stay a block away and wait till the police come, clear the area, say it's safe, and by that time, many of us have died. And most of the crime is black on black and brown on brown crime. And so we've got to address our legislators, our politicians, and the public as a whole, as a group, collectively, to say, these laws have to change. So Senator Bono is introducing legislation in Sacramento that will allow condoms in the prisons and the state system. But we need to talk about to Keith and to Haggerty and to Nate Miley and the rest and the county sheriff to have condoms just in Alameda County prison, in Alameda County jail. These women are coming out, and these men are infecting women at a traumatic rate. And it's black women who are suffering. And you don't even know you have it because, as you know, doctor, the liver is a non-complaining organ. It doesn't say it is in chronic pain or disease until you have cirrhosis or liver cancer.
Yes, ma'am.
Namaste. My apologies for my tardiness, but I came because we're here for solutions, right? My name is Lady Sunrise. I'm an artivist, performing artist with a message. That message is, I am a solution. And I'd like to encourage and invite us to elevate our consciousness to recognize that each of us are a solution, and that solution starts with self, particularly with our health. And I'd like to offer just something that made a difference in my life when my granddaughter sat next to me one day, and I guess I was having a moment. She put her arm around me and she said, "Grandma, what hurt you?" I thought, huh? Nobody ever said that. I never even heard that. What hurt me? I couldn't even begin. But since that time, I've gone deep to find out. And I think it behooves every one of us to look within and ask yourself, what's bothering me? The real thing, what's really hurting me? And it may go back generations. But I believe it's the beginning of our own self-healing if you start there. Physician, heal thyself. We start there, and then it can spread out.
I'd like the panel to address genetically modified foods, growth hormones, processed foods as a problem in the Black community. The other people have already gone up in arms about it. They are insisting on healthier foods. They know that these foods eaten among our people start at a very young age and end up coming to CU. So if you could address that.
Do you want to?
I'll start.
Okay, start.
Okay. You know, one of the things with the GMOs, I know there was the big, I think toward the tail end of last year, it was just a bit more uproar. I think there was a movie about it, or a documentary about GMOs, modified foods. One thing, when you're changing the basic structure of a nutritious, either fruit or vegetable, you're changing the nutrition. So just by, just literally you're changing nutrition. So so that's one thing just to think about with those. I think whether they should be, labels or whatnot, I think that was on one of the ballots last year. That, however, awareness, if someone wants to be more aware to make a more informed choice, I think that's important. For overall health as it relates to genetically modified foods, I think it just comes down to choice and I think it's just more important to go with much more natural foods, but
how can you make a choice if you don't know?
Right, and I think that brings it back to the legislation and making sure folks are aware. Again, talking to legislators and doing that, I think it's important.
One thing you can do, read your labels.
Right.
Simple.
And grow your own.
Grow your own, read your labels.
Community gardens are very important too.
Can I just address this real quick? So just like Dr. Penn is saying, obviously education is the key. We all need to know what we're putting inside of our bodies. We all need to pay attention what we're eating, what we're feeding our children. The other issue, and this is kind of an aside to it, but if you don't have a choice between the types of produce that you're being offered because you live in what we have in Alameda County are pockets called food deserts. So there are no grocery stores that sell fresh produce. Then you are, in a sense, prisoner to having to eat whatever the grocery store or the local liquor store, whatever offers to you. And in most things, the squeaky wheel really does get oiled. And so there are a number of communities in Alameda County where there is no grocery store that's greater than 10,000 square feet where you can walk or simply drive to or catch a bus to. That has to change. We need to have more grocery stores in Alameda County so that people have the choice of having fresh produce and healthy food that's available to you in your community where you don't have to get in your car and drive 20 miles or 20 minutes away to get to a grocery store. The local liquor store cannot provide the local produce that you need in where you can afford it. Who can afford to pay 75 cents per banana, right? You can go to Costco and get a whole bushel for $2. So really, you have to make a choice about what you eat, and the access to food is an important issue.